Hello, I'm Perrin Beatty. Welcome to the Business of Business. Throughout the COVID-19 crisis, we'll be having a series of conversations with distinguished Canadians about issues related to the Canadian business community, how we're overcoming the crisis, and where we go from here. Today, we're very fortunate to have James Scongack, who is the Executive Vice President of Bruce Power. Now, when you think about dealing with COVID-19 or with a global pandemic, the first company that you think of may not be a producer of nuclear power for electricity. And yet Bruce Power, on a number of levels, is intimately involved in this and in the response in Ontario and Canada. And we'll have a chance to discuss this with Bruce. Bruce, welcome. We're delighted to have you.
Great. Thanks for having me, Perrin.
Why don't we start with Bruce Power itself?
Sure.
Some people don't know the company. It's a major company in Ontario, a major employer, major producer of electricity and a critical part of the infrastructure. Can you give us the $1 tour?
Sure, absolutely. So what a lot of Canadians may not realize is the largest operating nuclear facility in the world is right here in Canada. And that's at the Bruce Power facility. So it's a facility located in rural southwestern Ontario. I know it's right in your neck of the woods there.
My old stomping grounds, yeah.
Yeah, old stomping grounds for sure. So we're in rural southwestern Ontario, and we're the world's largest operating nuclear facility. We have eight Canadian-designed reactors, and we produce about a third of Ontario's electricity. And what's really unique about the electricity that we provide, often when you think of nuclear power, you think of reliable baseload electricity supply, which is obviously what we provide. But the other thing that's really unique about our site is we're also one of the only nuclear facilities in the world that actually has a flexible capacity. So while we provide a third of Ontario's electricity, coming out of the last recession in 2008, 2009, we developed a flexible capacity, recognizing that market needs had changed at that point. And so 1/3 of our output, we can actually flex to meet the market needs. In terms of the ownership of Bruce Power, we're an all-Canadian company. We're about 48% owned by Calgary-based TC Energy, and OMERS pension plan here in Ontario. And the balance of the company is owned by our two unions, the Power Workers Union, the United Society of Energy Professionals, and our employees. So we have a very unique ownership structure as well. In addition to being a generator of electricity, we're also home to Canada's largest private sector infrastructure project, where we're investing up to $13 billion over the course of the next decade to life extend our assets to 2064. So it's a very busy site. Not only are we generating electricity, but we're making the long-term investments. The one other thing that often is not talked a lot about is that in addition to making electricity, we're also one of the world's largest providers of an isotope called cobalt-60. And cobalt-60 is an isotope that is used in medical sterilization. And so when you think of all of this personal protective equipment that we're relying in healthcare, whether it's masks, gloves, gowns, a lot of that personal protective equipment is sterilized. And so we provide almost 40% of the world's cobalt-60 for mass sterilization. And we provide that from our reactors, and it is sent to the global market through Ottawa-based Nordion. So, it's a really interesting site and a really, I think, critical piece of infrastructure for not only Ontario, but Canada.
Just on the subject of cobalt-60, it's obviously something that's very important for medical purposes at all times, but particularly so during a pandemic like this. I understand that one of the projects that you folks are partners in or looking at the present time is the sterilization of N95 masks so they can be reused. Can you tell us about that?
Yeah, absolutely. So we've partnered with Ottawa-based Nordion, who's really a global distributor of our cobalt-60. So once we produce it in raw form, we provide it to Ottawa-based Nordion. They process it into really small targets, and those targets go to a series of irradiators around the world. We're working with Nordion to look at the use of this sterilization technology to reuse N95 masks. You see a lot of technologies. We partnered actually with a First Nations owned firm here in the Bruce area we'll be announcing tomorrow that also has a sterilization, but it's not a gamma sterilization. We think gamma sterilization has the potential to produce much larger volumes of reusing a mask. But more importantly, if you look at, for example, the situation in China, they decided to approve a radiation back in February, actually, for a lot of their sterilization, and they cut the time to get clean personal protective equipment to the front lines from 14 days to 2 days, and we're able to move through 100,000 pieces of material a day. And so this is a very proven technology. It's actually a Canadian-based technology that we've exported over decades around the world. And not only do we provide the raw material, but we, through Nordion, actually provide a lot of the key technology. So, you know, I see this not only strategically important now, but something that people have just really taken for granted when you think of medical sterilization. I think it's going to be more important going forward.
If you're talking about N95 respirators, is this something that the sterilization could take place on site at a hospital, or would they have to be shipped somewhere else to be sterilized?
You would probably have to ship them because the irradiators are their own facility in itself. So irradiators are really good if you want to do large volume. So if you had, you know, 1 million N95 masks that needed to be sterilized, you would want to use an irradiator for that. It's for large volume, highly efficient sterilization. If it was a hospital technology, you'd probably look at something a little more like what we've partnered with a local community where, you know, you can do 1,000 to 5,000 masks a day. Something like that would be more appropriate for a smaller setting. But if you wanted to look at it on a sort of a national scale or a provincial scale and say, you know, how do we reuse some of these materials, that's what you would use them for.
Now, Bruce power has been declared essential during the crisis. In fact, it would be hard to think of any other sector that would be more essential than electricity during a crisis. This means that you would have to plan for a wide range of contingencies of disasters, everything from terrorism to a natural disaster like an earthquake. And you would have to have a series of plans in advance. To what extent were you able to plan in advance for a pandemic like this? Or did it require that you would have to make it up as you went along?
Sure. So the way we would look at this, we really would look at this from an emergency planning perspective. So I think I would answer, Perrin, that question two ways. The first way is in a lot of our planning we do on site, whether we look at it from a pandemic, a tornado, you know, the list goes on and on. What we try to do is initially in the planning set up command and control structures that are not specific to the initiating event. So, you know, we can think of events that have hit Ontario in the past. We can think of the blackout from 2003. We could think about
the ice storm, I guess, would be another example.
A number of years ago. So the first thing is we have an emergency planning organization that is really designed to be mobilized, deal with an emergent situation, have the right command and control structures, and within that command and control structures, ensure that you're focused on safe operation, the movement of logistics, and all of that associated activity. So the first thing I would say is whether you're in a pandemic or whether you are in an earthquake, which would not happen in this area, or a tornado or a blackout, the focus on the site is, or a winter snowstorm, the focus on the site is the same. How do we ensure the essential staff are where they need to be, healthy, safe, able to do their jobs? How do we make sure that essential supplies to the plant are there? And how do we ensure that essential equipment and safety systems are in place? So what we did was back on March 13th, we actually formally stood up our emergency management center. And that's where we stand that full command and control infrastructure up in place. But in advance of that, actually as late as late January, when we started seeing some of these signs out of China, we stepped into our business continuity plan. So it's really been an evolutionary process where I would say we jump into immediately our emergency management tools, which allow us all the command and control to manage it. And then on the flip side, what you do is you're proactive as an event is developing and trying to stay ahead of it. So, you know, we very quickly wanted to ensure we were ahead of the guidance provided by officials because, you know, we're required to provide an essential service and we have to make sure we're doing that safely and reliably. So really our focus initially was to get ahead of the event, and to immediately redeploy staff that did not need to be in the facility elsewhere. So as I mentioned, we stood up our emergency management center on March 13th. Within 5 days from March 13th, we had reduced the amount of people working on our site by 80%. And they were fully stood up, working from home, fully connected to systems. So the key people that need to be at the site operating the plant can, and engineering functions, other functions can do that remotely.
And that's in a rural area.
That is. And we're very well positioned to do with that because we actually plan for severe winter snowstorms, for other situations where you have to work remotely. So, you know, a lot of, even though the initiating event was a pandemic, there was nothing new in terms of the systems that had to work.
So you start then with a generic template and you adapt it to the particular circumstances. How smoothly did this work in this instance? Were there hiccups or surprises that you had, or did it work absolutely seamlessly?
Well, I would say, I would answer that question two ways. Firstly, that the actual work, the actual command and control, the designation of activities, that went very smoothly. You know, we drill on this regularly. So even as a member of the executive team, we have a crisis management team, and we meet daily. So we're even used to that cadence because there'll be times throughout the year we do mock crisis management teams. So everybody is used to their role. It's not, you know, you're in a real situation, but we've drilled it in the past. So I would say in terms of execution, it went very smoothly. I would say the two learnings we would have out of this that I would take away. The first is I think everybody was a little bit surprised with how weak the supply chain was in Canada for personal protective equipment. I would say that would be a learning. Obviously, we had a stockpile to allow us to operate for a certain period of time if we wanted to put people in masks or other things. But I think across Canada, right down to hospitals, you acknowledge there's probably a weakness in the supply chain. So, you know, if we sort of looked at having to be in this event for 12 months to 18 months, you know, and we had to rely on our own supply, that would be something we'd have to conserve. So I'd say that. But the second piece with this is there's a major mental health component with this. And so that's something you have to not make up as you go, but you have to, you know, be flexible and agile in your approach to recognize that, you know, people are not robots. They have family members, they have concerns. And, you know, we implemented things like a virtual process where every employee could get access to a doctor from an app right on their phone. The reason is, number one, you know, you've lived in rural Ontario, part of rural Ontario. You know, we don't want our healthcare system up here being jammed with people going into the emergency room. So those were some areas that mental health tools that we rolled out early to help folks. But I would say the actual response itself, very smooth. That's what we planned for. That's what we drill for. But I think as a country, we need to look back and say, do we have the right supply chains across the country to deal with a pandemic long term?
I fully agree with that. It's clear that after this is over, we've got to take stock. We've got to ask ourselves, not with a view to assigning blame, but what did we do right? What did we do wrong? Preparing for other crises in the future. What measures should we put in place right now? And we should give a lot of attention to the whole question of our industrial base. Do we have the capacity to produce the goods that are needed here in Canada, given the fact that we're seeing pandemic protectionism in other countries that are preventing us from getting our hands on the products that we need? So lots of lessons there to be learned.
Yes.
You were mentioning the challenges, for example, in terms of mental health and medical help for employees as well. Tell us about the challenges during a crisis like this of managing a company of this size, where you can't afford to allow the product to go down in anywhere, where safety is a critical element, and where you have thousands and thousands and thousands of employees. How's the process changed as a result?
Well, I mean, the first thing I would say is we live all in a small community. So, you know, where I am today, it's from my house in Port Elgin. You know, we have maybe 7,000 people in Port Elgin. So we're part of a small community. So, you know, people know each other. They know each other's loved ones. It's small town, rural Ontario. And so, you know, you can plan all of these things you want, but, you know, you have to, and even if you're just declared an essential service, one of the things you realize really quickly in a scenario like this is you can be whatever designation you want, but if there's an employee that doesn't want to come to work, they have a lot of, they don't really necessarily, there's not a lot you can do to enforce somebody coming to work. So being proactive in the community is really important. And we put a lot of focus on that. And so, I can give you a few examples. We put into service 200 surge capacity hospital beds that are now fully in service in Grey Bruce and Huron. Making sure food banks have the right resources, making sure PPE is in the hospitals, making sure, we held a number of telephone town halls where we had hundreds of thousands of people on with the medical officer of health. You have to look at an event like this outside of your business, because the things that are impacting your employees' mental health, their concerns and their fears, especially in a pandemic, you can't fix them from within your own business. If we just looked at our site, it's a big facility, it's 2,300 acres, has all the capability in the world, but all of the things that would be a concern to employees, the vast majority of them take place outside of work. And so I think there's a big component here of the hearts and minds. I think number one, people need to understand why they're coming to work. It's one thing to say you're an essential service. It's another thing to say, the only thing worse than a pandemic would be a pandemic with no electricity and we can't power our hospitals, or we need to provide those life-saving isotopes. So, I think our employees really, truly believe that it's important that they are at work and what they're doing. And whether we were declared an essential service or not, I don't think it would change the commitment of the employees to be there and play the role because they believe in it. But I really think that community response is important, because in a pandemic, you can't just look at your own business. You have to look at all of the things. It wouldn't be, we could put in all the prevention measures, hand sanitizer on site, you name it, have a textbook response. But if somebody going home goes to the grocery store or there's community spread, it doesn't matter what we do on site. So we've really put a major effort in that Grey Bruce, Huron County and Perth County area as making sure the community is taken care of. And if the community is taken care of, our employees are going to be taken care of. And if employees are taken care of, they're going to be able to safely do their jobs.
That's been an integral part of Bruce Power's culture for a long way back, of its institutional culture, the engagement in the community, investing in the community, being a corporate member of the community. But I guess it means that at times of a crisis like this, you simply step up that level of involvement that much more.
Yeah, it does. And the other thing to keep in mind is, especially when you deal with, let's say, local hospitals or medical officer health, in some of the larger urban centers, and I'm not saying it's easy for those folks in urban centers either, but small rural organizations, hospitals, and they don't have supply chain departments. They don't have, so when you're in a crisis situation like a pandemic, just being able to go and order materials, we sort of said, hey, we'll put our supply chain capacity together for 200 surge hospital beds. Pick the 4 locations, we'll have them delivered, everything from bed frames to PPE, you name it. Large organizations have supply chains that are set up for this. So a lot of this is really letting those local organizations take the lead, right? Because they're the right people to lead this. They know the community, they know that area of community requirement better than we do, but say, give us a to-do list. Think about our organization is at your disposal. What do you need, right? And we can move on that really quickly. And a lot of these things, you're in an emergency. You're talking saving people's lives, so we'll worry about the money later, right? We're not talking huge investments in the short term to protect a lot of people. And so we just moved very quickly and very decisively on that front. And what I always like to say, Perrin, is, we get a lot of credit in the community and a lot of kudos for what we're doing. But, look, we're a big company in a small town. And what we're doing is no different than what the small business owner in downtown Port Elgin is doing to his 10 employees. They're trying their best to contribute as well, whether it's sending hot meals to the hospitals or going in and sending some of their employees to help out at a food bank. So we're all doing our part. And I always like to say anytime, and I love kudos for Bruce Power, but we're just doing what businesses do in a community-minded sort of region of Canada.
Except you can do it on a scale that nobody else can match. Right. You mentioned hospital beds. What are some of the other examples of where you've used your corporate resources to backstop the community more broadly?
So we've really prioritized 4 areas in the region. The first was, and it may sound simple, but was with communications. So we deployed communications technology to be able to do, we've done now 4 of them, telephone town halls where we could get medical professionals, the physicians, linked in with radio stations to really get audiences of anywhere from 20,000 to 50,000 people. You know, senior citizens listening on AM radio stations, auto dial phone calls. I mean, using communications technology to actually get a message out, because what medical professionals in public health will tell you is early in an event, communication saves lives. So the first thing we did was make all those communication tools available and moved on those very quickly. The second area was personal protective equipment. So we had a stock of personal protective equipment on our site that would last us a number of months, but we recognized, you know, it's not the right thing to hold your stock on site so you're good for 3 months if your hospital down the street has 1 week left. So the first thing we did was put our supply chain into action to say, how do we get more personal protective equipment quickly? And we'll free up our inventory to get to the front lines. And we'll be having a really exciting announcement on Wednesday about just how much we've been able to do on that by the end of the month. We committed to Premier Ford there'd be 600,000 pieces of equipment by the end of the month. I can tell you
600,000?
Yeah, 600,000 pieces of PPE between masks, gloves, goggles, surgical gowns. We've been able to leverage our supply chain to get materials from all over the world. And we'll be making an announcement on Wednesday that actually will far surpass that. And that using our logistics supply chain all in place across Ontario by the end of April. So that was the second piece. The third area was, you have a lot of community organizations that have volunteers and know-how, but money is a problem. So what we did early on was we said, look, any dollars in our corporate social responsibility program, we told every organization, if you can't spend it on COVID and you can release it back to us, and we could reallocate it. And a lot of organizations that we said, reallocate the money the way you need. So we did that. That was in the first week about $2.5 million. And then we threw, you know, a number of other initiatives, food banks. So I really think the priority was communications, PPE, redeploying dollars, and now we're into retooling. We'll be, we announced last week with a local brewery, we're producing 55,000 bottles of hand sanitizer by the 27th of April, and that's going to be everywhere. So we're just keeping working at it and just doing our best.
It's extraordinary. You're mentioning the power of the supply chain and how helpful that's been in terms of being able to source materials for community projects. Have there been hiccups in the supply chain? What about for your own operations? You have to rely upon an incredible variety of suppliers. Some of them will have been designated as essential industries, some of them won't. How has your own supply chain worked for Bruce Power's purposes?
So I'd break that answer up into two answers. The first is sort of the core supplies we need to operate the plant. Because of that broader emergency planning, we keep quite a strong inventory through the supply chain to operate for quite a long time. Whether that's fuel we get from Cameco, whether it's certain things like helium or hydrogen, all those things we are very well. We're in you know, just because of weather or those kind of things. So we have not had any major hiccups from that. And I think a lot of that has gone to good planning and inventory management. I would go back to the area of personal protective equipment. So we were able to engage our supply chain to get access to this, but I do have to give a shout out to the federal government and provincial government. You know, a lot of this personal protective equipment you're ordering from overseas, areas like China, as an example. And you know, Minister Thompson, Minister of Government Services for Ontario here, she actually happens to be our member of provincial parliament, but really good, you know, the Minister of Procurement federally as well, you know, really good support on making sure that overseas we got that prioritization that we needed. Recognizing it wasn't for Bruce Power, the PPE, everything we were getting was to donate. But they were really good. And I also thought the area the governments were really good on was really, you can tell they put pressure on other countries around quality. Because, you know, you want to order this material, but when you receive it, you want to make sure it's good quality. And it was really clear to me the Ontario government and the federal government were really active internationally. And I was quite heartened by that. But you're right, over the long term, we need to look at either stockpiles of these materials, strategic stockpiles, or how do we manufacture some of it ourselves. And that's no disrespect to the other jurisdictions, but if you think about where some of this is manufactured from, we're fortunate that it did actually hit China first. Because if China was going through the curve that they were in February, now we would not have access to any masks in Canada. So we need to be thoughtful about, it may not be necessarily a full 100% made in Canada, but it may be about how do you make sure your supply chain's diverse enough that you would have an inventory until, and I think that's been the challenge in Canada. And you know what, I think it's been the challenge everywhere around the world too. So I don't think we're any different than any other folks, but I do want to give the governments credit on the PPE. I think they've just been fantastic.
Now, James, a number of the businesses I've talked to have said that their business has permanently changed as a result of the pandemic. A number of them have developed services or products they didn't have before. A number have talked about the fact they're much more digital than ever before. Some of them have talked about the fact that they were stunned to discover how seamlessly their employees could work from home. And they were questioning whether they would go back to the same sort of bricks and mortar office approach they had before. Do you see any permanent changes for Bruce Power, or is it business as usual once this is passed?
Well, I think that the first thing we're really putting a lot of thought into is that, we we're managing with COVID for a long time as part of society in Canada. And so we have to think about how could we work in not a COVID environment right now where we have everybody working from home. But if COVID is here to some degree or another for an 18-month, 24-month period, how do we have to look at all of our work programs differently, especially construction? So I think there's that. The way I would characterize it from a Bruce perspective is there hasn't been any sort of big epiphanies here saying, wow. I think what it has done though, Perrin, honestly, is it's forced acceleration of things. So for example, we have a lot of projects in place in information technology around remote visual inspection. So instead of sending a visual inspector to inspect a piece of equipment that has come in or a package, we have programs in place to do that virtually where you have a camera. So I think what this has done is it's forced people to get it done more quickly and more efficiently. I also do think that I think big companies generally are slow to adapt to change. If you look at kind of smaller companies, they tend to be sometimes more agile with giving people the flexibility of working from home. Whereas I think big companies of all shapes and sizes do struggle with that. And so I think if this says anything to people, my observation is that that actually you can get in some areas, some functions of your business, it doesn't make sense necessarily to have everybody in an old corporate building. I look at functions like information technology. Our folks in the information technology, they're knocking off more customer tickets than they ever have. We look at people in Bruce Power who do assessment for maintenance jobs, which is it's a lot of that is actually a computer activity. Well, they are working through that at record pace. So I think this is going to, I don't think it's going to change anything. I think it's going to accelerate it. But I also think it anchors in just how important some of those basic things are that we take for granted. And I think that is going to be I think one of the biggest change. I don't think, I think from now on, we're all going to be talking about pandemic planning as no different than an earthquake or a tornado or a terrorist attack or a financial crisis or you name it. And so I do think pandemics are in a different sphere now in terms of emergency planning.
Yep, very much so. And I'm struck as well that when you say that what this has done is to accelerate things that you were doing, it's a theme as well that I've been hearing from others, that yes, we were partly digital before, we're going much more so now, or we had some remote services before, we're having many more now, or we were looking at a different structure for how we could have persons with disabilities able to work in our workforce. Now we're discovering that there are new ways in which we can do that. So it has tended to propel society in a way in which it was going in any case, but more rapidly as a consequence. And most of the businesses I've talked to have said they're not going back to the way they were before, but they want to build upon the change that's taken place, very painfully taken place, and create something that's better than they had going into it.
No, I think that's right. And even think about it from a healthcare perspective, right? So we know, as Canadians, we've all been worried about the sustainability of our healthcare system. And, we do have to take the guidance of people like the Heart and Stroke Foundation who are saying, there are cases where even with COVID, people still need to go to the emergency room. But a lot of people have avoided using the healthcare system. They've moved to things like telehealth. They've moved to apps like we've provided our employees to get a common prescription refilled, right? So, and of course that's been because of a crisis, but I think what it may also do in some of our institutions is accelerate the pace of some of those items. Yep. Think of how quickly you can go get a business ramped up to make hand sanitizer now. If you tried to do that a year ago, it'd probably be a 3-month approval. So I do think what we've been able to do is take, from a risk perspective as a company, but also I think for government, I think people are getting better with making risk-informed decisions, and I think that's an area we often talk about, red tape in regulatory approvals. I think what this has done, Perrin, is, and I know that's a big issue for the business community, is I think it will also recalibrate institutions in government to say, when we have aggressive regulation, let's make sure it's in the areas that have that are the highest risk and the best public good, and not sort of I call it sheep dipping. But let's not have the same regulation for a small brewery that wants to make hand sanitizer versus a pharmaceutical company that wants to make a new vaccine. So I do think it will also change our view of that red tape, and make sure we're focusing the areas that need to be more rigorous, and there's some in our industry that need to be rigorous, in the things that truly need to be rigorous.
Certainly one of the issues the Canadian Chamber is going to be pressing on is that government has had to strip back a lot of the layers of bureaucracy here to enable them to catch up to the speed of the pandemic. And whether it's approval processes or whether it's just the level of regulation, I hope we don't go back to where we were before. The focus of government needs to be, how do we expedite, how do we facilitate, as opposed to how do we regulate, how do we deter, how do we delay? And that can be another area in which we see significant improvement. One last question. You folks are looking at setting up a council to look at where we go from here in terms of the economy. Can you tell us about that?
Yes, so next week we'll be formally launching a council called the Bruce Power COVID Retooling and Economic Recovery Council. And we have a large supply chain. About 95% of it is based in Ontario. Over 300 firms. It employs about 30,000 people directly and indirectly across the province through our infrastructure project and our operations. And so we're really committed to doing two things, and a lot of it is already underway. But the first is that not only because it's the right thing to do, but also economically, we need to help we all need to pitch in. And I know you, Perrin, thanks to your leadership in the Chamber, you've been encouraging the business community to do this as well. We need to help Ontario and Canada out of this. So, this council in the first instance is going to be focused on how do we continue to retool so we can move out of this more quickly. And that's a range of things like we've talked about today, personal protective equipment. How do we move more quickly? And so that's really what the first purpose of the retooling component of that council. And also recognizing that we have to be prepared for blips in the future and also need to be able to respond more quickly. And so the retooling part of this is us sort of working with our supply chain to say, we all have to contribute to the fight against COVID and making sure we're prepared for it in the future. So that's the first piece on retooling. But also the economic recovery piece is really important. We see, when somebody loses a job, that has a series of significant impacts as well on communities and families, on life and death, poverty, suicide, and we are going to be living for a long time with also some of those real challenges, societal challenges, which are also very significant. And so we believe that our supply chain, the nuclear industry, and our company can play a positive role in the economic recovery of Ontario and Canada. And so what we want to start doing through this council is talking about when it's appropriate, and we're not talking about going back to work earlier than the public health officials say we should. Nobody in Canada is advocating that. But when the time is right, how do we move quickly and decisively? And so we're starting to prepare our supply chain for that, but also some of our supply chain is really struggling financially. How do we make sure that they're liquid enough to be there? Now, I don't want to send with all these comments for 1 second that we're not struggling economically as a company. We are really struggling. We've really slowed a major infrastructure project we're doing. The costs to manage through this are significant, and it will have a knock-on effect. So we, like all big private sector companies, are economically challenged, but we will be more economically challenged if things start up again and we have suppliers that are out of business. And so I also want to recognize the levels of government. I know the Ontario government, through Minister Rickford, Minister Walker, local MPP Minister Thompson, but also Premier Ford, have been very supportive of the nuclear industry, and their ongoing commitment to nuclear allows us to say, look, we're not looking for a subsidy, we're not looking for any government money, but we need policy stability. We need to know, we're going to be there in policy, we're going to be able to sell power under our contract, and if we have that, we can take a long-term view. And so that's exactly what we're doing.
James, it's a remarkable story. It's been fascinating. Bruce Power, during the good times, is a critical part of Ontario's infrastructure and is so much engaged in the life of the community as a good corporate citizen. Yet what we've seen is that your importance, both in the community and as part of the infrastructure, has gone up dramatically during this crisis. And it's an example of the contribution that Canadian business can make in a time like this. Thank you for sharing that story. It was a pleasure to have you with us.
Thanks for having me.